Good Saturday morning to you, everybody, and welcome to HyperFit MD radio show, where age management is always the center of attention, along with Dr. Charles and Francesca Guggling. You like how I play on the word center?
Yeah.
Age management center. I'm Gary Byron. Last week, well, before I even get there, first of all, how are you guys doing, gang? Good to see you.
How are we?
We're doing great.
You look fantastic.
Doesn't a man always look to his wife to ask, are we doing okay,
What's the old saying? Happy wife is a happy life.
Right, yeah,
Sure,
exactly.
sure.
Yeah, so,
Did you have a good week?
Yeah. We're just we're getting more popular. Word of mouth is getting around, and we're getting wicked busy. I'm at the stage now where I'm spending all my time doctoring. I'm not doing anything at all with the business, which is, ultimately you're a small businessman, and so we're at the stage now where we're probably going to start looking for an APRN or somebody else to take some of the load off, so that I can we can expand the practice a little bit. It's time to expand. So,
like open up another.
Maybe, we'd like to have a satellite office probably further down 95 into like the. Right now we're in Milford, and we'd like to establish a footprint in Fairfield, Westport, down in those areas. So
what about more central Connecticut here?
Well, we have a lot of patients who drive down from around here.
That might be an idea.
Yeah.
Sure.
Guildford.
Yeah.
Yep. Definitely.
Nice.
Well, central Connecticut also. I mean, it's look, if we can build an empire, we will. That's what it's all about.
One brick at a time.
Exactly. We're like on the third brick right now.
Hey, all it takes is the idea and going. Even a small step forward is a step forward, right?
Moving forward constantly is really the issue more than anything else. That's what Francesca drives. She's the driver in the sense of anything new comes along, that we should probably address as a practice, a new service or something like that, something that is a hole in our practice that we don't really provide. Those kinds of things. It's all driven by her, because I got my head down working all day, and she's the one that is really the business visionary more than anything else.
So last week we had a very interesting topic of conversation, more of a part one of a part two series. Today being part two. Last week we talked about men's sexual health, and really kind of got into some detail when it comes to erectile dysfunction and libido and what exactly your like sexual health is. I thought maybe today we talk about female sexual health.
Okay.
So let's start. I'm going to start off today's show with the same question that I asked last week for men, but this would be referring to women. Mm-hmm. So let's talk about female sexual health. What are we referring to when we say female sexual health?
Men are a little bit simpler than women. I think we can start with a conversation with
that. I didn't say that, folks. That wasn't me. That was
in
the
terms
doc.
of this, yeah. So I would define female sexual health as the myriad aspects of the myriad factors that affect a woman's ability to enjoy and participate in sexual activity. That's sexual health. And again, yeah. And then again, we're going to leave off the table sexually transmitted disease, things like that, the kinds of things that you would treat pharmaceutically, because that's just a whole nother conversation, frankly. So we're really talking about the relationship issues, the hormonal issues, issues of the past, those kinds of things that affect female sexual health. So really, it's about being ready to go, wanting to go, and when you do go, being satisfied at the end of it all.
I think menopause is kind of, perimenopause is kind of the beginning.
Yeah. But yeah, I think that, yes, well, I don't think you can address it as the beginning, because there's so many other psychological factors and so on and so forth that participate in flagging sexual health in women. I think it's a lot more
you said
complicated.
there's a myriad of aspects to this, right?
Yeah, think about it. Factors that affect. Well, let's talk about, first of all, why I made this list this morning about let's see, the health benefits of good sex for women. Decreased stress, boosts the immune system, decreases blood pressure, improved cardiovascular health, better sleep, increased libido. It works the pelvic floor, increased intimacy, better cognition, believe it or not, and also at the end of it all, it burns calories, a few calories, okay, but factors that affect.
So what are the most important factors?
All right. First of all, there's the three phases of sexual encounter. Let's say for women, and it's for men also, but these three phases are very prolonged phases in a woman. And a man, he looks at a woman in a sexy T-shirt, and phases 1 and 2 are off the table.
I would imagine emotion has an emotional
Exactly.
connection, or
Well, there's desire.
Okay.
There's arousal. And then there's orgasm, the three phases of a sexual encounter. Okay, the desire, the emotion aspect of it plays a huge role in terms of it starting, getting started in terms of the desire aspect and the arousal aspect also. As far as desire is concerned, there's so many different stress-related, cognition-related issues, both of men and women, but I think probably more with women than in men. For instance, one of the statistics that's been out there for a long time is that 50% of women will experience any or all of the basically symptoms of sexual dysfunction in their lifetime. So mood disorders contribute to these issues, depression, a history of sexual abuse. Think about that, Many women carry into adulthood issues from previous sexual abuse that makes it very difficult for them to have a libido, become desirous of having sex, orgasming. Many women are anorgasmic because of situations like that in their past. Religion is an issue too. I mean, there's a lot of sexual taboos that occur that play a role as well with this.
How about some of the benefits? The benefits of sex.
Yeah,
I
think I addressed that. I jumped ahead on that one because
I know burning calories. It's probably at the tail end of that.
Yeah, the thing that we address a lot in our practice is intimacy issues amongst couples. Okay,
let's go there.
Yeah, because Francesca touched on menopause. One of the things that occurs with menopause is through estrogen withdrawal and testosterone withdrawal is libido drops to nothing in many women. Then after the fact, down the road after menopause, there's vaginal atrophy that occurs. So dyspareunia, pain on intercourse, can become a real problem as well. So much of the sexual dysfunction that we talk about in our practice has to do with the intimacy issues that occur with menopause. Because what is the essence of having a healthy relationship? And this is just an opinion, okay? But intimacy plays a huge role. And if intimacy leaves a marriage, frequently you get two people living sort of parallel lives. They sleep in the same bed or they sleep in the same house, okay? They are running a business or they're managing their children or something like that. But once intimacy leaves a marriage, it's a huge part of a successful marriage into old age. And one of the things that we do in our practice is we help to bring that back to marriages. Because if your libido leaves you, if you have erectile dysfunction on one side and libido issues on the other side, intimacy leaves the marriage.
But it's more than just intimacy that makes a connection between a man and a woman. Your libido could still be intact, and you just don't feel maybe an intellectual connection with somebody, or a spiritual connection with somebody, or an emotional connection with somebody. But physically, or with your libido, it's still there. You were talking a moment ago where men can look at a woman and go, "Oh yeah, hey buddy, take a look at her." It's like, oh man, give me one night with. That's how men think. Where women, I'm not saying there aren't women who think that way as well, but most of the time it's where you sometimes you sit there and say, "Whoa, what is she doing with him?" I mean, oh my God, he must have a lot of money. He must have. Well, no. Maybe he knows how to treat her and talk to her and make her feel like the most special individual that he's ever come across.
Absolutely.
And there is a lot to be said with an emotional connection that I think can also have an effect on your libido. I'm not the professional. I could be wrong.
Well, let's talk to the expert.
Well, let's bring her in, Francesca. Is there any truth to what I'm saying?
Yeah, there's a lot of truth to what you're saying. Absolutely.
Yeah, and emotional connection, I think, plays a huge role in this. And to me, intimacy, the word intimacy runs that gamut, okay? You can be intimate. There can be an intimate conversation between couples, those kinds of things. But what we're talking about here is kind of the physical intimacy aspect of it. Yeah.
I'm just, it's just the whole thing is fascinating. The differences between men and women and sexual health. Are there risk factors with female sexual health?
Well, yeah, the risk factors is kind of the same thing we talked about last week when we talked about men in terms of, we'll start with relationship issues, okay? You mentioned that right off the bat. Start with relationship issues. If there are issues with your relationship, the two of you are just not getting along, libido can leave a relationship. Depression, treatment for depression. Again, we talked about SSRIs and antidepressants. They're huge libido killers. Previous sexual trauma, we discussed that. Fatigue, simple fatigue. One of the things we talked about last week when you were talking about your campaign, you know, to a large degree, if you're working a 100-hour week, sex tends to take the back burner in that regard. Again, diabetes mellitus. Women who are hypo or hyperthyroid have a lot of sexual issues. So one of the things that we always address in our practice is making sure that the thyroid that they are euthyroid. Their thyroid is functioning normally. Alcohol. Alcohol has an acute effect on libido. If a certain level of alcohol makes you super horny, but you get past that and there's nothing left. Or constant or chronic alcohol abuse can be a real libido and sexual function killer.
What about drugs?
Definitely, especially opiates. Opiates, anti-anxiety, anxiolytics like benzodiazepines, things like that. People take Klonopin. One of the favorite medications of physicians to treat somebody who's having sleep difficulties is Klonopin, which is ridiculous because Klonopin is a very highly habit-forming benzodiazepine. And to take Klonopin every night to go to sleep, it becomes a lifelong habit. And that is a libido killer, and that is a killer of sexual intimacy. That's a very good question. But then when you have a postmenopausal woman, you're also talking decreased testosterone, decreased estrogen. Women make testosterone in their ovaries and in their adrenals. So when a woman's ovaries stop functioning in menopause, they still have a touch of testosterone. Their serum testosterone is still probably 20 to 30% of what it normally is. And as those T levels drop off, libido drops off significantly. There's another hormone called DHEA, which is in the supply chain for testosterone. And DHEA drives libido in women. And that's just a supplement. That's not even a pharmaceutical. But it is, it's interesting. DHEA is a controlled substance in a lot of countries. But in America, where they control everything, DHEA is considered a supplement because it is a hormone. So there's hormonal issues involved as well. And thyroid definitely plays into that role as well. So postmenopausally, fall off in sexual function is it's very definitely always hormonally related. And then there's all the relationship issues and all that other stuff that comes into play as well.
How about it affecting your libido?
How about what affecting your libido?
You were talking about opioids, right?
Yeah, sure.
And how strongly it can, over time, can affect your libido.
Yeah, sure. It's a centrally acting drug that just basically turns off libido. It's like a switch.
How about the effects of orgasm?
A person who orgasms frequently tends to have a better libido, very definitely. And women who are anorgasmic for one reason or another, we talked about sexual trauma and all these other things. A woman, anorgasmia is a much greater problem typically in women than it is in men. And again, it's multifactorial. It's a hugely complicated issue.
I was just curious, what can affect a woman's orgasm?
Lack of stimulation. If a man, for instance, a vaginal orgasm is it's not a very common thing. Usually takes clitoral stimulation for orgasm to occur. A lot of men don't even know where it is. A lot of women don't. One of the things that floored me when I was a surgeon is how many women go through life without ever actually looking down there and having no idea what their anatomy is like. You need a man who is going to have a sexual is going to be intimate with a woman needs to know where the clitoris is, because if he doesn't, neither of them are going to get, well, she's not going to get where she wants to go. Clitoral stimulation is really important. And what happens post-menopause is that you get a certain level of diminution of the nerve supply to the clitoris. It becomes less sensitive with menopause.
Same could be said with a man's penis, though,
Yeah,
right?
absolutely. Sure. Yeah.
I'm just wondering, are there any treatments for any of this? Or are we talking strictly pharmaceuticals? Is there anything...
Hormones
Yeah,
and
it's
postmenopausal
really
women, hormone replacement, counseling. So there is such a psychological overlay frequently with women and a sexual dysfunction that counseling frequently comes into play under these circumstances. Sex therapists are very helpful with these kinds of things. Getting out of your own head. Same thing with erectile dysfunction we talked about last week. Sometimes you just got to get out of your own head in an effort to have a healthy sexual relationship with somebody. But the treatments, for the most part, are hormonal education. Like I said, there's a lot of people who just don't understand the anatomy of the female pelvis, and that's part of it. A penis is easy. It's like right there. You're looking at it. You know what you're supposed to do with that, right? But a clitoris, the average clitoris is is a couple of inches long, but the only part of it that is visible is, maybe an eighth to a quarter of an inch. So you kind of have to know where you're going, because clitoral stimulation, for the most part, is essential for female orgasm.
There's an old saying where to get a guy to have an orgasm, it's the same thing with every guy.
Yeah.
But with women, it's different with every woman.
Yeah.
But you're saying, but more often than not, it is clitoral.
Oh, well, it's definitely plays a role. Yeah, definitely plays a role. Definitely.
Yeah. Go ahead.
So I recommend for women, there's this amazing woman. Her name is Esther Perel. She's had a TED Talk, which is, really pointing out how important it is to have intimacy with your partner and making time for each other, going out on dates. She's written a couple of books. One of them is called Mating in Captivity. It's really interesting, and I recommend women seeking her, listening to her, reading her books, just to be in tune how important it is.
Spell her last name, please.
So it's Esther, Esther, and her last name is Perel, Perel.
Make sure you duck, go. That name. Folks, you are listening to HyperFit MD radio show, where age management is always the center of our attention here, along with Dr. Charles and Francesca Guglin. I'm Gary Byron. Last week, we were discussing men's sexual health. This week, it's female sexual health. And it's just, in some ways, it's the same, but in many ways, it's different. As you were discussing, there's a myriad of factors that go into female sexual health, Doc, and I wanted you to pick up from there.
We were talking about postmenopausal issues. One of the things we didn't discuss before is dyspareunia, which is a fancy word for pain with intercourse. It's not something that men experience very often. It is something that is fairly common in postmenopausal women, because postmenopausal, one of the postmenopausal aspects of vaginal health is that you get vaginal atrophy. The lining of the vagina becomes very thin, and it is prone to trauma. Vaginismus, which is another word, is a word for a muscle spasm that occurs when you're trying to achieve penetration. Vaginismus can be a problem. It's just muscle cramping down in that area that can basically arrest the whole aspect of penetration, which can come from vaginal trauma. Episiotomy, which is that cut that GYN docs do to the vagina to allow a baby's head to come through the vaginal canal. Episiotomy can be a very tender spot for a lifetime after that, and can be a cause of vaginismus. Also, we talked about sexual trauma. In previous lifetime, sexual trauma one of the results of previous sexual trauma can be a real problem with vaginismus. And there's treatments for that. We don't do treatments for that in our practice, but mostly it's dilatory treatments, using what's called a bougie to just dilate the vagina softly to kind of get rid of that vaginismus aspect of it. So there's lots of different problems that occur.
What about childhood trauma?
Yes.
Could a woman take that into adulthood and keep that for whatever reason?
Sure.
Embarrassment, maybe it was taboo, maybe something happened, maybe it doesn't even have to necessarily be sexual.
Right.
But something that they're carrying with them into adulthood, could that affect them sexually?
Yeah. Well, let's set aside, which is one of the obvious aspects of childhood trauma, which is sexual abuse, okay? You can carry that for your entire life, but children are often traumatized by their parents who scold them for being curious about their body, okay? Those kinds of things, a certain level of curiosity about the way your body works and learning the way your body works. Masturbation as a young child, okay, something the boys just naturally are good at. Girls are scolded for it. It's considered, I don't know, what's the word, dirty or whatever. A lot of women have never really explored their vagina, and so that's part of it also.
Religion, I think.
Yeah, religion. plays a lot.
Catechism classes that you learn.
No, she did.
Well, but there's the old saying where if you don't know how to give yourself an orgasm, how do you expect someone else to?
Absolutely.
I mean, you want to talk about exploring
Very
your
well
body.
put. Very well put.
Well, I wish I could tell you I'm the one that came up. No, I mean, that's a saying that's been around for a long time. How do you expect anybody else to? You're looking for, especially in the early stages, I would imagine you're looking for a little guidance, and it's like, you give me the blueprint, I'll take it from here.
Right.
And then you'll never have to give me that blueprint again.
Yeah.
But if you can't give that to me, then, it's going to be trial and error for a while, right?
Yeah, I mean, look, I think it should be taught in junior high school. You and I, I'm of the age where the school nurse took all the girls out of the classroom and they disappeared for an afternoon, and the boys went out and played baseball or something. Like, where did they go? To teach them about menstruation, that kind of thing. But I never was taught anything about sexual health when I was in school.
But your parents, your dad never sat you down and had a even a brief discussion where you sit there and say, "Son, I'd like to talk to you about sex." Yeah, Dad, what would you like to know? I mean, one of those kind of things.
No, I never had that conversation.
You found
with
it
my
out in the
father.
streets with your friends that were a little older, right?
Exactly. Yeah. I mean, I did have that conversation with my kids, but mostly the conversation. By the time I had the conversation, they were very aware of the mechanics. The conversation I had with them was more about respect for women and knowing that no means no, and the fact that porn does not really represent real intimacy, those kinds of things. I mean, well, of course not, but boys don't know. They need to understand. They need to understand that there is an etiquette involved, and that can land you in jail. I mean, if you cross the line.
You bring up, we're running out of time. Since you brought up pornography, have we become desensitized in some way?
Yes, absolutely. Part of sexual dysfunction in men is porn addiction. Very much part of it. Definitely.
Addiction?
Yeah, porn addiction. If you masturbate 5 times a week, watching something on your telephone, okay, where does that leave you in terms of libido and desire to have open intimacy with your partner? Okay, talk about refractory periods. The amount of time that it takes for a man to be able to have an erection after sexual satisfaction. That period gets longer and longer as we get older, and if you're masturbating daily to porn, it really has a huge effect on relationship issues.
Well, I would imagine with the advent of the internet and porn being so readily available 24/7 on your mobile device at any age. I mean, you want to talk about youth being desensitized. I mean, these must be issues that people come in and talk to you about.
Yeah. Well, you don't hear about that too much, but it's definitely part of the problem. It's funny, guys will talk about their erectile issues and stuff, but it's something I should probably ask. I don't really ask that question, but it actually brings up a very good point that it's not part of my workup when it comes to that. Yeah.
Bringing this back to women in the final minute or so of the show, probably less of a concern with pornography with women, although I would imagine it exists, right? Or
I would imagine. Not being a woman, I don't know.
well, no, of course not. But I mean, it just sounds like there's so many other issues that women will endure more than men will.
Yeah.
And with their sexual life. Is there one underlying issue though that you want to hammer to our listeners? Hammer into our minds when it comes to female sexuality and female sexual health.
I think the one thing I want to hammer into women is that it's healthy to have an active sex life, and it doesn't have to leave you when you get older. It can continue well into old age.
Well, not everybody necessarily has a partner, right? Neither.
Well, we talked about masturbation. Sex is sex, to a certain degree. Not everybody has a partner, but are you going to seek a partner if you're not libidinous in some way or the other, I had a woman come into the practice the other day, and I asked her about her sex life, and, I'm not interested in that. And I said, well, don't you think that's part of the problem here, Plus, frequently I'll have couples in the office, and a woman will be going on and on and on about her different problems that she's having. She's here to become a patient in the practice, and her husband's sitting right next to her with his phone like this, and I'm saying to myself, I'm not a shrink. I'm not an expert on this, but I think part of your libido issues is that, some people just walk the earth
in their phone
in a parallel fashion, not really attending to the other person's needs,
Yes, the good old cell phone, the mobile device,
Yeah.
a necessary evil. You can't live with it. You can't live without it. And sadly, it's only going to get more technical. I mean, that's just where the direction that we're going. Folks, you are listening to HyperFit MD, where age management is always the center of attention. You can contact Dr. Charles Guglin. It's very easy to do so, though. Let me tell you this. Start with the website. You might get your questions answered there. Of course, if you're like me, it'll probably provoke other questions. HyperFitMD.com. Once again, HyperFitMD.com. You can email them if you've got a question at cguglin, that's Guglin, MD, at HyperFitMDAMC.com. And, of course, you can make your appointment. This is the old-fashioned way. This is what I would do. I'd just make the phone call. It's area code 203-890-9777. Once again, 203-890-9777, and they are on Noble Street in Milford. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Until next Saturday, have a good one, everybody. So long.